Okay, so now we're recording.
Sorry.
As I will probably repeat many times, this project and this toolkit in particular was about collecting the wisdom, the knowledge, and the advice of people who have been doing the work on campuses every day on many different campuses, and what they have learned, particularly relating to how can we address alcohol's role in sexual assault. From things as abstract as how do we phrase that question, to things as concrete as what particular partners should you be working on for particular aspects of that. And so I had the privilege to work with some incredibly brilliant people. My co-principal in our consulting agency, LB Klein, as well as Rebecca Woofter and Lee Helmkin-Cherry, also co-authors of the toolkit, on a number of different projects relating to alcohol's role in campus-based gender-based violence. And this toolkit is embodiment of what we learned from practitioners with some other aspects of our projects woven in. And I will talk about those as well. This project of interviewing a number of different individuals has a very critical feminist participatory action approach that we thought was very important to representing what people who are doing the work see as not only the most important challenges, but also the most important areas for future development and where are we seeing success currently. And so this research was done alongside CAPA, the Campus Advocacy and Prevention Professionals Association. I say alongside CAPA because we don't identify the exact participants who we interviewed and who contributed to this toolkit, but they represent CAPA in sort of the truest sense of what are the advocates and the preventionists on campus, as well as their partners in community-based organizations who serve campus constituents, students, teachers. What do they think about these issues? CAPA itself, if you are not a member and you work closely with campus organizations, I urge you to go to the URL and join. It's a very simple application, quote unquote, and we do not require dues. It's a free organization to join. It's led by volunteers who donate their time. I'm one of the co-facilitators, as well as LB, and Lee Helmkin-Cherry is also on the Leadership Council. If you are wanting to know more about that, feel free to contact us off the webinar, or please go to the website. And CAPA was an integral part of collecting this information. It's one of the first groups to really bring together campus advocates and prevention specialists and professionals who are working on this issue. And so we were able to use CAPA's formation and listserv to help us gather the wisdom and the knowledge from campus-based practitioners. And you might hear a quick pause at the end of each slide as I check the questions to see if anyone has asked anything. So I haven't muted myself, don't worry. This toolkit project, it's been percolating a lot with myself and with LB for, I think back to 2000, maybe like 14 or 15. We actually started putting the groundwork together in 2017. And these statistics on the slide are probably not anything new. We know that alcohol use is involved in 50 to 70% of campus sexual assaults. That in and of itself is a pretty nebulous statistic. Alcohol use could refer to the fact that people in the area of the assault were using alcohol, or that the perpetrator was using alcohol, or that the victim or the survivor was using alcohol, or that the perpetrator was using alcohol to incapacitate the survivor in the situation. And so that percentage is not very helpful but it clues us in that we have a really strong co-occurrence here. And it's something that we are often urged as campus professionals to address, right? Please address this role that alcohol plays in sexual assault. But if you look through the literature, if you just do a Google search for it, there's not much evidence-based practice on how to address alcohol's role in sexual assault. There is a great deal on what not to do, which is, there's so much on that we actually have a section in the toolkit about that. But the bulk of the toolkit is instead on not just what you should do, but what are folks doing. And I think a really important aspect of the toolkit as it evolved was to really record and legitimize many of the experiences that we might feel on our campus and feel like, gosh, it's just such an odd thing that's going on here. But really, we're seeing the same things in many different campuses across the country. Okay. So as I mentioned, this toolkit is primarily based on a number of interviews. We recruited our interviewees from the CAPA listserv, and to be a member of the CAPA listserv, you have to be a member of CAPA. There is no dues to be paid, but it involves individuals who spend a majority of their FTE or time working with campus-based survivors or doing campus-based prevention work, sort of those two sort of large categories. And then beyond that, right, we asked additional inclusion criteria of at least 0.5 FTE dedicated to sexual assault prevention. And we limited it to campuses that provide or offer housing for more than a year on the campus. And that does mean, and we'll talk about this probably in the next paper we're trying to do, that some campuses, such as strictly commuter campuses, are going to not necessarily be covered in this toolkit. And I think a lot of things could be translated to those settings. But in situations, especially where maybe the majority or all of your students are of legal drinking age, a lot of the tangled issues that come up with alcohol's role on campus, period, and then alcohol's role in campus sexual assault are put in a different light and just are enough of a different conversation that we didn't want to, we didn't think we could handle that conversation in just this first study. So after we had limited and recruited individuals through the listserv, we conducted interviews that ranged from as quick as 20 minutes to 78 minutes with 23 folks back in 2017, and we were able to provide them with a gift card. It was we were able to get some funding for the study, and it's always good to compensate folks for their time in the field. Afterwards, we had done the interviews, we transcribed them and conducted a number of different codings and thematic analysis, and I will not go down that rabbit hole any further. I would love to talk about qualitative coding and analysis, but I don't think that's why most people are on the webinar. But needless to say, we were trying to reach saturation, which is this idea that we're not saying that any of the quotes or the things that came up in the interviews are happening on 90% of campus, or X% of our interviewees represent all of the campuses in the country. What we're saying is that all of these issues happened at least one place, and when multiple people mention them, we do represent that. So this is giving us a breadth of what comes up when people think about alcohol's role in sexual assault on college campuses, and then a little bit about the depth of what are areas that many different people, many different campuses are encountering, and what are some areas then and some advice that people give for addressing those different areas. Okay. And as I mentioned on the previous slide, 2 slides, this is a participatory action process. So we involved CAPA and the listserv and different reviewers from Kappa and from other research domains in this process to provide insight and to guide the questions that we asked individuals and the ways in which we used and processed the data. So that was a little bit about our practitioner interviews. There are, in the toolkit and in my webinar today, there are a number of other things that went into the fondue pot or blender, I don't know, that created this practitioner toolkit. If you've looked at the toolkit, I think the last half, maybe even 2/3, is very focused on the quotes from practitioners. But earlier parts, which we'll get into, focus also on connecting what we know in the research to the interviews and what practitioners are telling us. And one of the reasons for that is to make this toolkit as useful as can possibly be for individuals who don't have a lot of time to sit around and read all of the peer-reviewed literature like I do, because grad students have tons of time to do that. So LB and myself also conducted a systematic review that looked at alcohol's role in campus sexual assault, specifically looking at bystanders on campus, and within that, the different role that alcohol use by perpetrators, victims, and bystanders plays in how bystanders then choose to intervene or not. And that's hopefully under review and should hopefully be out soon. The practitioner interviews, of course, as well. We also reviewed the literature when we could find some available literature. There's maybe 2-3 dozen studies that really look critically at different aspects of alcohol and its use in relation to campus sexual assault. And we've included references to that in the toolkit, as well as summaries to hopefully get folks the information they need without digging through a lengthy publication. And then, of course, all of that combined into the toolkit, which, if you look at the very end, the appendix talks a little bit more about the creation process, and you can see what all went into it, as well as what sorts of expert reviewers we involved in this. And I go into a lot of the detail with the methods here to really underscore not only how much we are hoping to elevate the voices of the frontline practitioners. We talk about campus gender-based violence, but also recognize that what practitioners are saying sometimes do and sometimes does not match with what we see in the literature. And that's one of the things we're really hoping the toolkit would highlight. In some places, it does do a great job of that. And we can use this toolkit then to pivot some of our campus conversations or campus partners into focusing on areas that really need attention and can get some good traction on. Okay. Looking at who we interviewed, as we said, we conducted 23 interviews and had participants working in 21 different states across the U.S. So a good distribution. Good to see that. Their length of time in the field ranged from 1 to 23 years of experience, and I think it was really important that we included folks who are fresh out of graduate programs or just coming into the field as their first job, perhaps, because that can give us a sense also of where are we in terms of the professional development and the preparation of folks who are coming into the field to be preventionists on college campuses, as well as what have people who've been in the field 23 years, what have they seen, what has worked and not worked, and what advice would they give to folks who are coming into this work and confronted with how to engage with the topic of alcohol's role in campus sexual assault. A number of the individuals were hybrid prevention advocacy folks, so you can imagine they had a lot on their plate. And some individuals were just health promotion generalists, so not only talking about sexual assault on campus, but maybe also doing the sexual health. They may have also been doing the positive flourishing aspects, right? Or talking about alcohol use or tobacco cessation. just sort of doing a general health promotion approach. We also had some individuals who were involved in the Title IX process on their campus, and a number who were strictly doing campus gender-based violence prevention work on their campus. And you can also see that we had a fairly good distribution between public and private institutions, as well as a few religiously affiliated institutions. And the size of the institutions as well varied quite significantly. So we can, again, because it is qualitative in nature, not say that we are representing everything and how frequently it's happening, but we can certainly say that these issues are affecting most campuses and a lot of diverse campuses within. Okay, so all of that preamble, here we have gotten to the toolkit. And if you haven't downloaded it yet, that is not a clickable link, unfortunately, but hopefully not too difficult to type out. Not only was CAPA's participatory involvement very helpful and essential to this project, we also received some funds from Prevention Innovations Research Center at the University of New Hampshire, and those funds really helped us to compensate our interviewees as well as do some more of the coding work. So a very small amount of money, but it really makes a difference in terms of asking people to donate their time or to be compensated for their time to really hear their thoughts on such a critical and not too easy to discuss issue when it comes to preventing campus sexual assault. This is a very broad overview of the toolkit and for the rest of this webinar, and also for, there will be a part 2 of looking at this toolkit that will focus much more on how you can use different parts of the toolkit and apply it to certain aspects of campus work. The different components are there, hopefully not just to help you, but to offer you easy things to share to your partners on campus and to individuals maybe you're hoping to partner with both in and off of your campus. And the first thing that we wanted to do was recognize that there are some really great resources made by other people that cover this topic of alcohol's role in campus sexual assault, and also provide really useful approaches to campus sexual assault in general. So we start with companion resources, and that's where we direct you to all the other readings you should do after you finish the toolkit. So maybe we shouldn't have put that up front, just so it'll distract people. Oh well. And then we move into a research review. And as clearly as a graduate student now, I certainly had fun writing the research review. But our focus throughout all of this toolkit was to bring research into a practitioner-focused lens and really look at how does it relate to what people are going about on their day-to-day when they're planning different activities, when they're thinking about what sorts of events and what content to put into their events they want to talk about, as well as representing to folks what the research tends to focus on. If you look through that section, we start by looking at perpetration, because we know that when we talk about alcohol's role in campus sexual assault, we need to look primarily at the perpetrator, right? And that comes from a lot of different angles, not only perpetrator use of alcohol themselves, but also how alcohol can be used as a weapon, as a means of intoxicating or incapacitating another individual. And that leads us to talking about alcohol's role in consent, which is a very difficult conversation to have on college campuses, especially for students who maybe have not had a conversation about what consent means, period. And then we're also involving this aspect where if you are intoxicated or you've consumed any sort of alcohol, you may not be able to properly weigh some of the aspects. We also include a little bit on bystanders and how alcohol consumption by different parties involved in a sexual assault or a gender-based sexual assault can relate to bystanders' decisions to intervene or not. And that is a short section in the toolkit. As I said, hopefully a larger systematic review will be coming out. Just as a spoiler about that, much of the research unfortunately focuses on victims' use of alcohol and how perceptions of victims' use tends to decrease bystander intervention or affects the way that they assign blame in the situation. But we actually do not have any research on the actual effects of alcohol. So no one has done sort of alcohol administration trials to see whether or not bystanders who are intoxicated themselves or in a situation where people are actually drinking, how they would act. We only have hypothetical studies, and many of them focus, unfortunately, on victim alcohol use, which you can sort of tell us a bit of a clue as to what people have been fixating on in terms of victim blaming and alcohol use, and one of the areas we hope to address with this toolkit. And the last two sections in the research overview relate to policy, because we know that on college campuses, policy can have an impact. There is limited research on its impact relating to alcohol policies and how they impact sexual assault. We also have limited data. We only just started to have many campuses doing their climate surveys on this topic a number of years ago. And so as we collect more data and schools start to build baselines and understand the different programs they're implementing, hopefully that area will grow. And our understanding of how policy influences alcohol's role in sexual assault will also grow. And then there's that last section on prevention evaluation, or evaluations of prevention programs, sorry. And this is particularly looking at programs that would have used alcohol as a topic when addressing campus sexual assault. And again, it's pretty limited research. Hopefully, when we redo this toolkit in 5 or 10 years, there'll be a much bigger research overview section, as this will have energized and intrigued people to look more at this role and to figure out ways that we can help campus practitioners to address alcohol's role in campus sexual assault. The next couple sections, social norms, social justice, and strategies across social ecology, are what we call and also trauma-informed messaging, are what we call key connections. And these are the biggest areas, if we're thinking abstractly about what alcohol's role, quote unquote, is, that we think it's important to reflect on how alcohol is influencing campus sexual assault through these different mediums. Social norms being what people expect others to do or what they expect is appropriate in certain circumstances. What is it appropriate to do when you've been drinking? What is it appropriate to do to people who have been drinking? Right? Those sorts of questions. And what does the research say? And what do practitioners say about it? Social justice in thinking about access to alcohol can be a powerful way to begin that conversation. Who is allowed to access alcohol, bring alcohol onto campus? How does that relate to then the power dynamics when we think about gender-based sexual assault or gender-based violence on college campuses? Strategies across the social ecology, and I'll get back to this when we talk about partners, is important because simply removing alcohol from the campus, it isn't going to end campus sexual assault. And in fact, even just the phrase removing alcohol from campus, does that mean like we're removing all alcohol, we're removing all restaurants that serve it? Like how big of a radius from campus are we going to be removing these things? Are we trying to remove alcohol advertising from campus? How do we deal with things on the internet? So thinking about the social ecology is putting alcohol's role in campus sexual assault in the context of how does it impact the individual, right? Individual alcohol use. How does it impact the relationship level of variables? What are role models doing when it comes to alcohol use? How are people talking to their peers and their significant others? And then also at the community, the society, and the policy level. We'll get into more of that later. And trauma-informed messaging is one area that alcohol's role is not always thought of, because having a clear connection between the alcohol education office or the health promotion specialist on campus who is doing the alcohol programming and education is maybe very critical to think about in a trauma-informed way, because many messages through no direct malevolent fault can come across as victim blaming. And so thinking through how different messages from different partners and individuals on campus may be influencing this conversation is critical, and we devote a page or two to that, and also to hearing what folks, what practitioners have said in terms of what are the key issues that they've across and what their advice is. And the last couple sections, I believe we'll get into later. We won't go into them too deeply, other than to say partnerships, common challenges, answering difficult questions, advice in the field, and vision for the future. This is where we really focus on practitioners because the research field is just not there. And so we need to be talking to the people who have the most experience with this work and really listening to them and being able to start to replicate some of what's working on different campuses and then sort of aggregate from there. And so what we've done is center not only the voices of practitioners, but tried to provide some framework or note some themes that arose from reviewing all of the different interviews in those different sort of areas of advice and vision and challenges. So that font is very, very small. But this is one of the pages from the toolkit, and it has a lot of different sort of components that, as you read through the toolkit, I would urge you to take notes. We thought about making like a workbook for people, but then we realized that those weren't fun when we all were in school, and people probably wouldn't be too keen if we had them go back to school and download a workbook along with the toolkit. But one of the more useful parts, I think, of the toolkit in sort of how to adapt it to your campus is these next step boxes. We throw a lot of information onto the page, and we throw a lot of information to the reader as they're going through the toolkit. And these next steps are about what do I do after I've read that, like, I need to partner with, let's see, on this checklist is basically everyone on the campus, everyone nearby the campus. How do I go about doing that? And the next steps are some ways to maybe ground that and think about every journey begins, with the first step, and what are some of those first steps that you can take. We also try to suggest ways to share the information with key partners and key stakeholders. We have some how-to boxes. For instance, this one is on how to identify different stakeholders. And this, as I mentioned, is an exhaustive saturation look at what practitioners told us. And so these different strategies and questions may or may not work or be relevant to your campus particularly. In thinking through, sort of on the key partners checklist, you may not have a new student orientation office. There may be sort of something that everybody contributes to equally, right? So thinking through how to partner, quote unquote, partner with that may look very different for you than someone on a campus that has 35,000 students and they have 6 people at a new student orientation office. You may not have fraternity or sorority life on your campus, and so there are a multitude of options and checklists there that we hope will make sense to your campus, but certainly is not to say that you must partner with all these people. They may not exist, or they may be partners that you've already been engaging with for years and years. And I think at that point, I hand this over to Sally for a bit.
Okay, thank you. Before I start this section here, if anybody has any questions or need any further clarification, about anything that you've heard so far. Please feel free to put in your questions in the dialogue box, and either Drew or myself will be happy to address them. Okay, so in speaking about partnerships and how essential that is, so here are some initiatives that are happening in New York State to address alcohol's role in sexual assault. So we do have a statewide college initiative, which is a partnership with the Office of Alcoholism and Substance Abuse Services, or OASIS, their college prevention services. They received an environmental prevention grant of $2.5 million that's been awarded to 20 SUNY and CUNY colleges in 18 counties across New York State for programming and efforts to prevent and reduce underage drinking and drug use on college campuses. The funding will support the development of campus community coalitions and foster community partnerships to strengthen local efforts. Funded programs will be expected to achieve the point is to achieve a reduction in alcohol and drug use related problems such as overdoses, injuries, and assaults. There is the website there listed, so you can take a look at that and become more familiar with it. I'm just moving on to the next slide here. So in addition to the OASIS projects, the New York State Department of Health also has a rape prevention education program called Healthy Nightlife Community Initiative. Those studies have shown a significant link between increased sexual violence and alcohol consumption for both perpetrators and victims, as Drew has already mentioned. And so through our rape programs, regional centers, this program trains bar proprietors and their staff on what is sexual violence, how to observe and assess situations for signs of sexual violence, bystander intervention skills building, policy change assistance, and environmental assessments. So there are 5 out of our 6 regional centers are utilizing the Safer Bars curriculum created by the Arizona Safer Bars Alliance and Arizona State Department of Health. And 1 regional center is utilizing the Outsmart New York City Bar Bystander curriculum. So this is an effort to address the issue on a community level, because as we know, students are going out into the community to go to bars, go to restaurants, or any venue where they interact with socially. It's important for them to be able to support students. And then an additional program that we have is the Safer Bars Communities, working to prevent sexual assault. This program is a community effort of local bars and restaurants to train and empower alcohol-serving establishment staff to recognize and stop sexual aggression. This regional collaboration These regional collaboration initiatives in Albany, Oneida, and Schenectady counties, and it's funded by New York State Department of Health Rape Prevention Education Cooperative Agreement. There's a website about that as well that you can take a look at. And then in Onondaga County, Vera House has raised the bar, and they partner with alcohol-serving establishments as well in the community to create safe environments. In the same manner, in an effort to prevent sexual and relationship violence and sexual harassment. Participating establishments receive training for staff in the Safer Bars model, which focuses on bystander intervention and building skills for identifying and responding to sexual aggression and relationship abuse, with a focus on prevention as well as additional benefits that you can check out on the website here. So if you have any other questions in regards to that, you can address them to me or to the Technical Assistance Center, and we'll be happy to follow up with you with any questions that you may have, or connect you to any of your local resources that may be engaging in this type of activity at this time. So I'm going to hand it back to you, Drew.
Okay, thank you. This is just an example of one of the next steps, and in particular, I think this next step could be, we have a limited amount of space on each page, but this approach could be used with any partner, particularly one if they are reticent to get involved, or perhaps they have a very different approach to this topic. But it can be very useful to sort of scaffold or sequence the different collaborations or partnerships, and doing anything twice, obviously, we don't always have time for that, but it can be very beneficial to highlight the barriers that are coming out. Perhaps if you have a partnership or an office that is not quite working on the same page with you when it comes to trauma-informed messaging or promoting different social norms relating to alcohol use on campus, doing sort of the same process separately and then coming together to compare notes or to do the process again, sort of seeing where the different thinking from two different groups on campus is clashing or is coming together, can not only identify the barriers in the areas that need more work in creating cohesive partnership and cohesive messaging that is consistent across different offices and across campus. It can also identify areas that there is agreement and similarity that you can then build on as you try to untangle and address the different areas that are not as consistent between the different groups. And each next step is different for each section, but they all are ideally about moving the conversation forward and involving more people in the work. Because one of the overarching things from the toolkit that we learned and that we are continuing to explore is that the role of alcohol just on college campuses is such that any single office is not going to be able to address it all by itself. There are so many different facets and so many different areas in which alcohol has a role on campus life, and then particularly within campus sexual assault, that it is really a community approach that is necessary, or that folks have found to be the most effective in addressing different elements of that topic. In the interviews with the various 23 CAFA members, we asked 3 different questions. We asked, how would you describe alcohol's role? We asked, what is some of the current challenges that you're running into? We asked, what are the current efforts that are being done on your campus? And this question in particular, folks responded not only with how they would describe alcohol's role, but often went on to talk about how maybe their students or colleagues or key partners on campus or certain administrators, high-level administrators on campus, might describe alcohol's role in sexual assault. And it gives you an idea of the fact that while there is understanding within our field of this central sentence. I wish we could have just made this the title of the toolkit. Alcohol does not cause sexual assault, which is where, at least in my experience, almost all presentations that address this topic have to start, because we have to sort of remind everyone, like, they don't cause sexual assault, even though oftentimes we imply that they do, or different aspects of our marketing or messaging might imply that. Alcohol does not cause sexual assault, period. And the way to talk about it is unfortunately nuanced, and the way that people often reported that they talk about the role of sexual assault is that they didn't, and if they did, it was in such a truncated way as to come across as different from the original meaning. And so instead it could come across as causing sexual assault in some way, or as an excuse for those who caused harm. So it's not the alcohol that committed the violence, but because the violence was committed by someone who had had some alcohol, we need to think, oh, what about that? So alcohol coming up as sort of a rationalization or a minimalization of the violence due to the use of alcohol in the circumstance. Mentioning alcohol use specifically by the survivor as a way to imply fault, guilt, or blame on the survivor's fault, implying often that individuals should know what alcohol will do to them and how that will increase their likelihood of being assaulted, and that in some way is not only on the survivor, but is a legitimate cause of violence, right? And so often we're encountering this idea that, well, if people if people on campus just didn't drink, they wouldn't be sexually assaulted when they're drunk, which is just a bonkers statement to try to unpack, because there's many different layers there, and trying to think through what do you address first. If somebody asks that at the end of a presentation, when you really need to give a whole new 30-minute presentation on sort of just that perception. Describing alcohol's role as complicated sexual assault is also something that people usually mention, often half in jest, before really trying to unpack it more in the conversation. And it's certainly, if the whole toolkit hasn't convinced you yet, alcohol's role is quite nuanced and complicated. It does not cause sexual assault, but it is certainly in the situation and often utilized as either camouflage or a weapon in circumstances. And so when folks mention alcohol's role as a weapon, they often talk about obviously incapacitating an individual and sexually assaulting them. The camouflage angle is one that has been much less studied, but it's the idea that if there are many people drinking in a party or a situation or environment, using alcohol as a weapon can fly under the radar of even vigilant, bystanders, of people who are looking out for this sort of abuse of alcohol. And it would also, cover the circumstances or instances when different substances such as roofies or ethanol are being used in an environment where everyone is expected to drink. It can also, in the sense of camouflage, be used in combination with that sort of excuse for those who cause harm, as sort of everybody was drinking, like everybody was sort of, stumbling around, like I wasn't really groping that person, I was just drunk, right? And so it can act, sort of alcohol-saturated situations can camouflage problematic, harmful behavior of individuals, perpetrators. Okay. Next, we asked, what are any of the current efforts on campus that you are doing to address alcohol and sexual assault? And so this, this list of items is pretty inclusive of, what does a typical practitioner or preventionist do on college campus? Try to address some of it with policy, work it into consent education, often because it's mentioned in policy, it needs to be mentioned in consent education. Trying to do some limited messaging through posters, through different social norm campaigns. Bringing it up often, Greek life orientation came up a great deal for campuses that do have Greek life, because often the connection between alcohol use and Greek life spaces is often a very strong one. And so it's usually a key component. Talking about alcohol in general is a key component of new Greek members' orientation to that environment. And so partnering with Greek life to then add on a component, big or small, where they're also addressing alcohol's role in sexual activity and sexual assault more specifically in that circumstance. So really with the Greek life area of campus, which is really only one area of campus. Bystander intervention scenarios often are mentioned in the context of, well, we just sort of have alcohol in those scenarios, but not necessarily really thinking critically about, so why is alcohol in that situation? Is it just that we were trying to think of a typical party situation on campus, and obviously, like, there's going to be alcohol at that party, which in and of itself, right, is probably saying something about what the different social norms and expectations about alcohol in that community and how they can be addressed, and maybe even going beyond sort of the scenarios to think through sort of alcohol expectations. And then I want to say most, if not everybody, talked about needing to debunk myths relating to alcohol's role in sexual assault. The classic question of, well, if two people are drunk, can they not have sex anymore? Like, are they assaulting each other? Probably something that all of us have had to address or heard asked and discussed. It's one of the difficult questions in the toolkit that we aggregated sort of several different folks' thoughts on it, because that is sort of the question that we get asked and we need to answer when we talk about alcohol's role in sexual assault. And so there's obviously no one right answer, because so many different things can come into those different myths and debunking them. But hopefully that difficult questions section is helpful in unpacking those. And here I have a couple quotes. Like the one in the top right, it is extremely policy-driven and extremely conduct-driven, and just sort of reflects that, like, when we talk about alcohol and sexual assault, these are just such touchy, sensitive topics that we just need to go with exactly what is written on the page. And often that can lead to a very policy conduct approach, right, without any sort of conversation or attempt to address different norms on campus. And then in the bottom right, talking about conflating sexual health and sexual assault is, of course, something that you need to address if they haven't had sexual health education before. You're trying to talk about alcohol and its implications for consent. Is something you need to do before then you can talk about how assault is related to alcohol. And a general lack of time came out not only in current efforts, but in talking about current challenges. So what challenges do you face in addressing alcohol and sexual assault is also its own section, in addition to the difficult questions. Unsurprisingly, much of the interview is focused on not just the barriers that are encountered, but we do make an attempt to catalog those and really list those out, but also how to get over those different barriers. And some of the bigger ones, go to the next slide, see some of the quotes on this, I think are encapsulated in that current challenge of larger or lacking bigger systemic change and oppression when we talk about who has access to alcohol on campus, when we think about what certain events on campus tend to be strongly linked to high or problematic alcohol consumption. And this is certainly not true across the board, but things like tailgating at sporting events, homecoming or alumni events that are very large and have a lot of adults who have graduated coming back to campus, often involve alcohol in very central ways, and are often promoted by different offices on campus in ways that may conflict with some of the messaging relating to alcohol and campus sexual assault. We also heard that there's just so many more conversations we could have. It just feels like we're doing just a drop in the bucket, and it's so many more drops you want to give and need to be given. And also this idea that alcohol is code for many different things, and that alcohol, the drinking might just be sort of a larger like party culture, or just alcohol. When people say, oh, we have an alcohol problem, they may be talking in the more victim blaming sense. And so just fixating on alcohol can be a safer way to channel some of those more problematic attitudes and assumptions about campus-based learning. Okay. Questions? We also asked practitioners, what do you wish campuses, your campus, other campuses, would do to address alcohol and sexual assault? And this is where we get into sort of the visions part of the toolkit, and really thinking about, I painted probably not the most encouraging picture, right, of what folks think relating to alcohol's role in campus sexual assault. But these same individuals also have really big and exciting ideas, and they can see the way forward with addressing this issue. So it's not a matter of we have no idea how to address it. It's just that it is certainly a big task, and there are ways that we need to start sort of shifting the pieces on campus and shifting sort of the minds and the attitudes of maybe colleagues, and before we think about students, to getting to some of this work. And there is a great deal of research on alcohol prevention, sort of not even thinking about sexual assault, but just sort of alcohol education and prevention, and encouraging campuses to translate that research into practice and put some real sort of funding and teeth behind research and evidence-based practice on a campus. Focusing on the social justice and the equity involved in these conversations. I've hinted at a lot, right, to the idea of who has access to alcohol on campus. To take a sort of the Greek life example, usually on campuses it is such that sorority houses are not able to host parties, to hire bartenders to serve alcohol within their spaces, while fraternity organizations are typically allowed to do that. And that can just in and of itself is reinforcing different standards and different norms, and often that this is related to the national organization's policies, but thinking through how does, your campus and how do the different offices, how do they portray that, right? That is a pretty fundamental difference that most first-year students could probably pick out, and then how can we incorporate this into our messaging to perhaps not undo it immediately, in the next couple months, but start to plan some messaging or ask the questions of our students of, well, like, why do we feel it's okay? What are some other ways we might approach this issue? Moving beyond the campus bubble, not just in policy, but also in partners, was a critical aspect that came up in thinking through students are buying alcohol off campus, and we can ban alcohol in the dorms, but lots of individuals live off campus. And sort of, well, how are these approaches really embracing the idea that the campus is integrated into a community context in many settings, even if it is sort of a college town or a campus town where most of the town is the campus. How is the rest of the community being involved in this conversation to address alcohol's role in sexual assault? And that gets to challenging institutional norms, right? How can you get partners who are off campus to perhaps support different norms and to think through how off-campus partners are influencing the norms on campus, and the different messages that we're setting, both in terms of party settings, safe partying, trauma-informed messaging, and sending consistent messaging across these different topics, is one of the different areas. And I do want to say all 6 of these are sort of laid out much more in the toolkit with quotes and with ideas and advice from practitioners. How are we working on each of these with partners and working on them across the different levels of the social ecology? And I will very briefly go into those. There's no way to do them justice in 2 minutes or a whole hour. But if I could organize the toolkit to sort of be at like meta levels, I would go through it, and in each of the sections I would think about at the individual level, at the relationship level, at the community level, and at the policy and society level. And a lot of the current challenges and a lot of sort of what are folks currently doing with alcohol tend to fall at the individual level of addressing it. And there can also be a lot of pushback at the individual level because often it can come across as, sort of an individual's opinion or stance on alcohol is what's under attack, and when it's really we're talking about sort of education in the larger campus picture. And so if you're running into difficulties, in developing a partnership or working with a particular strategy, morphing it or thinking about it at a different level of the social ecology may be a way to sort of continue to make progress and also shed some light on why that particular approach wasn't working at a certain level. So the individual level may be providing training for different folks on alcohol and sexual assault. The relationship level may be thinking through how you're training bartenders or bouncers who may be working parties or who work nearby to campus, even forming those relationships and knowing that they have a strong relationship to the campus or the community crisis center or prevention center can be a strong sort of indicator of the work being done. And then once you have a lot of those relationships, you can leverage all of them into a community level action, getting signs put up in the local drinking establishments or in different areas where alcohol is being used to address this issue, to address the social norms there. And then eventually, I mean, especially if you have, faculty that are very active in legislation or advocacy, you can start to move this momentum to the policy level, or you can go from a top down and engage partners who maybe you wouldn't have thought of as potential partners or allies in the work to address alcohol's role at a policy and society level, and then kind of take that momentum and those wins and connections back to the individual level or the relationship level. So there's a lot of interplay across the social ecology, even though we did break them, for the sake of a list, into different categories here. So I believe that is my time. Thank you all very much for tuning into this part. There will be a second part, and I will leave it to Dolly for any other wrap-up.
Sorry, thank you so much, Drew. That was excellent. Does anyone have any questions that they may want to pose to Drew at this time? You can type them into the chat box if you do have any questions at this time. Okay, so there will be a second part to this where we'll get in more in depth as to how to actually use the toolkit. Or in developing messaging or partnering. Also, so that everyone is aware, we will be having follow-up in-person regional meetings where we will actually have we're going to build some skills with this toolkit. We're going to actually practice some of the activities that are explained here in the toolkit. Such as the next step section. Actually, Drew, you picked out there was one here that we're actually going to use. We're going to try and, for example, develop a short little sound bite to try and engage partners into doing work with you as an example of something that we're going to be doing. If you want more information about that, you can definitely email me at dsanchez@niscaza.org. And I'd be happy to fill you in. Our very first one will be in the Northeast region on October 10th. If you want more information about that, you can also reach out to me. So without further ado, unless people have any other questions, thank you very much for attending today, and see you next time.